Hi, everyone. It's Dr. Ozzy here. Welcome to the More Than a Pretty Face podcast.
Calling all plastic surgery enthusiasts. I'm so happy to welcome esteemed plastic surgeon, TikTok star, respected author onto the More Than a Pretty Face podcast. Dr. Richard Brown is here today to give us an inside look into what it's like to be a plastic surgeon specializing in breast and body work. He also has an amazing book called The Real Beauty Bible, which is his guide to helping patients through their plastic surgery journey and everything they need to know. Welcome, Dr. Brown. I'm so excited to have you on the podcast today.
Thank you so much. I mean, we haven't gotten to meet yet. It's all been TikTok greetings.
I know. And you are like such a TikTok star and you post the craziest videos. Guys, you have to check him out on TikTok. He has 6 million followers now. I don't know how many you have. 1 billion followers.
A little over 5, like 5.5.
And he posts the craziest surgery videos. How did you decide that this was something you wanted to do?
TikTok, you mean? Just getting involved?
Uh-huh.
Yeah, I didn't start Instagram until 2016. So I was kind of behind the curve. I had back surgery and I was sitting on the couch and I'd had someone managing at my office. And I was like, man, I need to take control of this. So as I started to build Instagram, I realized I came in at a time when they really started to shadow ban plastic surgery. And so I just wasn't getting off the ground very strongly. And then during quarantine, when TikTok hit, and I just stuck with it, because I love to educate and I like to teach. So I started doing this question of the day every day on Instagram and things were growing slowly. But then Gary Vee was like in my ear all the time, right? He's like, you got to get on TikTok. You got to get on TikTok. So I just decided to pick it up during quarantine. And I tried to watch what other doctors were doing. And I love music and I really enjoy making videos to show what we do. But that's really how it happened. I mean, when I first started, it was more about motivating pre-med students. I didn't really show surgery in the beginning.
Yeah, and you do such an amazing job at that. I feel like you're such an inspiration to not just med students, but really just everyday people that might be struggling with whatever might be happening in their life. And you sort of give them that hope, you give them this guidance and this reassurance. And I think it's amazing. That's one of the things that drew me to your account was not just the surgery, because it's cool to see all the surgery stuff, but this other aspect, this motivation, this inspirational content that you put out there. I think it's amazing.
Yeah, it's fun. I like to mix it up and I need to mix it up more because I really enjoy that stuff. I appreciate that.
So let's talk about cosmetic surgery and plastic surgery. We hear this term, I'm a cosmetic surgeon. You hear people say that. And if you're in medicine and if you've gone through all the training, you always wonder, what does that mean? Cosmetic surgery. What does that mean? Does that mean you're a plastic surgeon? Does that mean you're a dermatologist? What does that mean? So, tell us about what your thoughts on this day and age where everybody has a channel and everybody can be board certified. And it's sort of become very obscure really about what that means. So what does it mean to be board certified plastic surgeon?
Yeah, you nailed it. So, this is a topic that comes up amongst us who are board certified by the American Board of Plastic Surgery. So I'll give you the quick and the dirty, and then I'll tell you why I think it's important. I always give this cliche statement that all plastic surgeons are cosmetic surgeons, but not all cosmetic surgeons are plastic surgeons. So what does that mean? It's really a technical distinction, right? So the American Board of Plastic Surgery is the only institution in the United States of America that can certify plastic surgeons. So when we get certified to be plastic surgeons, we're certified to do reconstructive work, cosmetic work, everything there is to do in plastic surgery. We are certified by the American Board of Plastic Surgery to do that. On the other side, when you see someone's website and they just say cosmetic surgeon, you have to kind of dig a little bit deeper because you want to know, okay, they're a cosmetic surgeon. Like, what does that mean? Are they a plastic surgeon or not? Well, what people can do, regardless of whether they're good surgeons or not, because I know a lot of really good surgeons who are not board certified plastic surgeons who do great work. But what's important to understand is that those doctors might have an ENT degree, or they may have a family practice degree, right? Like a family practice doc might go online to the American Board of Cosmetic Surgery, which is not recognized in the United States as a certifying institution for plastic surgeons, but they go through this training for, quote, cosmetic surgery. And so the family practice guy on the corner can start doing lipo in their office. The problem is this: those surgeons or those doctors, if they have a complication, they'll never get hospital privileges because they're not board certified plastic surgeons. So if you have a complication and you need to go to the hospital, they can't take care of you. So while there might be great surgeons who aren't board certified plastic surgeons, you got to be careful, because that's where a lot of people get duped, and they end up seeing someone they think is a, quote, plastic surgeon, and they might get botched, which they can get botched by a plastic surgeon too. But at least in plastic surgery, what I like to tell people is that respect the craft. Like, we've been through the training. We did the work to train to do all this stuff. I didn't choose plastic surgery just because of cosmetics, but then people who are just doing cosmetic surgery oftentimes are choosing it just to do cosmetics. So that's really 100%. Where it is.
So tell us about your journey. What does it take to become a plastic surgeon in the U.S.?
Yeah, so don't do it the way I did it. I didn't decide until I was 27. Wait, I was 26 when I decided I wanted to go to medical school, and I didn't start until I was 27. So I was a senior in college. But there's two tracks you can take in the United States. First, everyone has to go to medical school. So you get your 4-year degree in college, and you go to medical school for 4 years. After that, you can apply 2 different routes. The first route is called a combined program, and that's a 6-year program where when you get into that program, you automatically are accepted into plastic surgery. But your first 3 years are focused on all the other surgical specialties. So you might do general surgery, orthopedic surgery, neurosurgery, and they trickle in a little bit of plastic surgery. And then their last 3 years are all plastic surgery. So that's one way. The second way, which is the way I did it, was I knew that I wanted to be a surgeon. I actually was an orderly in the OR the year before I matriculated to medical school. And that's where I fell in love with surgery. I was like, this stuff is so cool. So I didn't really know what I wanted to do. But I basically went into general surgery thinking, hey, I'll do this. But if something else kind of tickles my fancy, maybe I'll do that. And in the middle of that, I decided I wanted to do plastic surgery. So what I did was I completed 5 years of general surgery, which you could do neurosurgery, you could do ENT, you could do any surgical residency. And then I applied for another fellowship in plastic surgery, which at the time was 2 years, and now it's 3. So I did 5, actually did 6 because I did a year of research, but I did 6 plus 2. And now they would do whatever their surgery specialty is plus 3 extra to be board certified in plastic surgery.
Wow. So 8 years minimum.
Oh God, yeah. Easily.
Right? Because a lot of people,
actually, no, 10 years minimum, really, if you count med school.
Yeah. So if you're, a family practice trying to do lipo, or you're OBGYN doing nose jobs, there is a difference in that training, that intense training that you get. If you have a complication, you're sort of out of luck because you.
Oh yeah, big time. Here's what I tell people. Everybody on the road has a driver's license, pretty much, right? Pretty much, but not everyone's a good driver. Right. So even board certified plastic surgeons, amongst those, there are not good surgeons. So you kind of have to do your homework. Even though you're going to choose a board certified surgeon, it doesn't mean that you're guaranteed a good result. You still kind of have to do your diligence.
Agree, 100%. I think that's so important for any specialty, particularly, cosmetics and plastics, because it's so in demand. Everybody wants to do it, but not everybody has the credentials and the experience and the qualifications. So we got so many questions from Instagram for you. There's a lot of people that want to know a lot of stuff. So let's get into it. So there's a lot of questions about fat transfer instead of implants for breast augmentation. Is that something you do? Is saline safer for breast augmentation than fat transfer? What does that entail?
I love this question. It's a great question because I actually get DM'd a lot about this one. I don't know if I've made a YouTube video on this yet, but this is a great question. So here's how I counsel people when they ask me this question. It would be awesome if all we had to do is use fat to enhance the breast, because that's all it would ever do. It's a natural substance. It's easy. The problem is with fat transfer, only about 60% of fat lives and about 40% of it dies. So that's the first problem. The second problem is it really depends on the patient. So if we're going to do fat transfer for augmentation, who would we do it in? So a patient with really tight skin and probably smaller breasts with no sagging or drooping at all you can fill their breasts. Now, will that give you the same volume as an implant? Not even close. But that is a patient that if they wanted modest enhancement, you could do it. On the flip side, if you're mommy makeover time and you've had 4 kids and your skin is stretched out and you need a lift, you cannot put fat in those breasts and expect them to be lifted and more round. So that's not a good patient. So I will tell people in general, fat is not the mainstay of therapy for massive volume enhancement. So if you're looking for market volume change, as well as really nice round shape, it's going to be a silicone or a saline implant. So that's a great question, and I get that one a lot.
So what percentage do you do saline and what percentage do you do silicone? Because the silicones are great now, right? They're cohesive.
Yeah.
You can cut through it and it doesn't, you got one right here. Yeah. So, and they feel,
I do a lot of Zoom
what are the
consultations.
benefits and the difference between the two? When would you choose one or the other?
Yeah, pros or cons. So 99% of what I use is silicone. And that's usually because when the patient is in the office and they feel a saline versus silicone, saline feels like a water balloon. Silicone feels softer and nicer and more natural. And as you pointed out today, we're in like our 5th generation gels. So literally what we used to think of as the gummy bear gel was just the one implant. Now they've introduced that gel into multiple different types of implants. So it used to be only in the textured implant, but now you can get the gummy bear gel and it's just a smooth round implant. And the benefit of that is that if you have a microperforation in a silicone implant, people envision just stuff oozing everywhere. Those are the old implants. The newer implants, while they still can liquefy a little bit, they pretty much are like gummy bears and they stay cohesive. The benefit of saline, if someone actually is scared of silicone, I would tell them 2 things. Number one, saline implants have a silicone shell. You're getting silicone either way. You're just not getting an implant that's filled with silicone. But the benefit is if a saline implant ruptures, you look down and you're like, well, that's not right. So I can go get that fixed. For silicone, it's usually a microperforation. And you may not know that this thing is ruptured for years because it doesn't just ooze out and change shape. They're highly cohesive. Can that hurt you? To date, we don't know. BII or breast implant illness is a different topic. But to date, we don't know that it just leaking inside the capsule in the pocket is going to harm you. We just wash it out, take it out, and put a new one in.
I see. Wow. Wow. When do you know that you should have your breast implants redone? Because, you may have them in for 10 years and you think, well, should I go in and have them taken out?
Yeah, man, followers teach me stuff every day. And the other day, the general, yeah, in good ways or bad ways. In general, the dictum is this, that I tell people that old school comment about you need to have your implants changed every 10 years is not true. I tell my patients, if you have them 20 years and they're nice and soft and they still look pretty and you're happy with them, do nothing. And what my follower taught me was, she asked the question, she said, well, maybe the 10-year rule, was that because of the older type of implants that might have been more prone to rupture? And I was like, you know what? Probably. But in this day and age, we don't tell people to, I would never marry someone to a surgery every 10 years. So you can keep them as long as they're fine. But rupture rates are about 1% per year. So at 10 years, you have about a 10% rupture rate.
So do you recommend people get like MRIs just periodically if they have them to see if there's any rupture, or how do you?
Yeah. So the FDA recommendation is that you're supposed to get an MRI 3 years after silicone augmentation, then every 2 years after that to evaluate them, but nobody does it because insurance won't cover it. So, but MRI is the best way to pick up a rupture, but I've seen MRIs get it wrong, but that is the best test.
Wow. Yeah. So I have had my implant for, I would say, for about 7 years. And I always wonder, should I go and just check and make sure? So a lot of people wondered that.
It's a good question. Now, I always tell people don't do anything if you like them.
True. So another question said, do you recommend a breast lift with no augmentation for like a 25-year-old who just lost 40 pounds?
Yeah, great question again. So here's the deal. It depends on what your goals are. So the real question is, what does an implant add to a breast lift procedure? When we do a breast lift, we have to make multiple incisions. We take out extra skin and we tighten up the breast. When we do that, it depends on the patient. If they don't have a lot of tissue, they're not going to have a lot of volume and roundness to the breast. If they have a little bit of tissue and they want to be round, That's what an implant adds. So what an implant adds to a lift is what we call the upper pole volume, or the upper part of the breast. So when you look at the breast from the side, it could be that teardrop shape or more round shaped. The implant in someone who has droopy breast that's getting a mastopexy but not a lot of volume, the implant gives that nice round shape. Well, someone might say, well, I don't really care if they're that full up top. I just kind of want them lifted, and I don't mind that more teardrop shape. Then I would tell them, don't get an implant. So an implant adds upper pole volume. That's really, it adds global volume, but it really adds upper pole volume, which is the most important part.
I see. Another breast question. I'm 31. Breasts are sagging since I've been 28, size 38C. Is there a cause for that? Are there any non-surgical ways of lifting the breasts and making it better?
Yeah, I wish there was, but there's not. And the cause of that is everyone is genetically different. I have seen 20-year-olds with 70-year-old skin, like really loose, just not great quality skin. And vice versa. I've seen people in their 60s and 70s with incredible skin, as you well know, doing what you do. It really depends on the patient. And some people just were not blessed with great quality skin, so they're kind of stretchy early on in life. And some people have great quality skin, and it's just kind of a crapshoot what you got. But there's really no non-surgical procedure to lift the breast.
So really, like I tell my patients, everything we do as plastic surgeons, dermatologists are really customized to that patient. Just because your friend was able to get an implant without a lift doesn't mean that you're going to have the same take on that.
Absolutely.
And another breast, what to do about breast capsular contracture? Do you feel like almost anybody that gets a breast implant is going to have some capsular contracture? Because I see all your videos on TikTok, and you cut through that capsule, and some of them are so hard.
Yeah. Most of the ones that I show when I'm just taking out implants are nice and soft. So let's educate the public about a capsule. So what is a capsule? A capsule is basically it's not a foreign, it's a tissue layer that forms around a foreign device. So when I was in trauma surgery as a general surgeon, some guy have a gunshot to the thigh. We'd never take the bullet out because it wasn't near any structures and we weren't going to go dig for it. Well, lo and behold, 3 or 4 years later, it's surfacing at the skin. And they want it out, and we would take it out in clinic. And when we would open up the skin, they would have this nice white glistening capsule around the foreign body. Well, the same thing happens to an implant. Like an implant gets this capsule around it, and that capsule in general stays nice and soft. But in some patients, if they develop a capsular contracture, which I just released a YouTube video on this, what happens is the capsule starts to get tight. The sac gets tight around the implant, and it can start to misshape in the implant. When they feel their breasts, they're like, God, it's different shape and it doesn't feel good. Now, the ones that you see me show that are like drastic, like hard calcified capsules, we don't see that anymore in our young population, because once you start to get this, today a woman comes in and they're like, there's something wrong. And we catch it early enough that we go in and take the capsule out and we don't worry about it. The women that come in with those calcified contractures, they're like, oh, it's been hard for like 15 years. So I thought maybe I would do something about it. And that's when they get hard and calcified, and they have to come out. You got to take them out. They cause pain.
Is there somebody with more risk for that? Is infection, like some low grade infection? I see you do the betadine. We call it, what do you call it? Soy sauce.
The forbidden soy sauce.
So is that lessen the chances of that?
Yeah, the theory. So the theory for capsular contracture is the following. We don't know why it happens. And in my video I just released, if y'all hit up my YouTube, what we think happens, or what toxicologists think happens, is there's a small layer that forms around the implant, and bacteria impregnate that layer. Once bacteria latch onto this silicone device, you cannot kill them with antibiotic. Now, they don't cause an infection, but what they think is happening from studies is they send a signal to the overlying capsule to cause it to start to tighten. Mm-hmm. So when we take out implants for capsular contracture, you have to take the device out and the capsule out and put a brand new implant in. So I don't know if there's anyone that's at higher risk, but if someone has new implants and they get like a UTI or they have an infection, they could seed their implant and end up getting a contracture. Mm-hmm. So that would be something early on. But usually, we tell people for dental procedures, I don't know that there's real research to tell people to take antibiotic, but I kind of do. I'm like, you're getting a little bacteremia. You might want to take something if you have implants.
Yeah, I
Oh,
never
yeah.
thought about that, but that makes so much sense. Just like you do with, implants everywhere else, like knee replacements or,
Yeah,
things like that.
totally. I mean, and for those who don't know what a bacteremia is, the mouth is full of bacteria, and we stir up bacteria, it gets in the bloodstream, and that can travel to the breast.
Yeah, that makes total sense to me. A couple more questions if you have time. Should you
Of
get
course.
liposuction, tummy tuck, if there's a possibility of having another child?
No, I wouldn't. To me, people get really excited about having their surgeries and they want to get their bodies back. But if you're going to continue to have children, I would wait. And the reason is clearly pregnancy is going to make changes. And we all know that cosmetic plastic surgery is not cheap. And who wants to have it redone? So I always try to counsel people that if you know you're going to have more kids, I would wait. The only time that I say you don't have to wait is I'll have some young women come in here like 23, 24, and we'll have the whole conversation about implants and what that means. And they're super excited and they're not having kids for 10 years, And so why should they deprive themselves of having what they want or what they're insecure about, which I'm totally fine with. So I'll let those patients have them and then tell them, look, you may have changes when you get pregnant, but if you're not having kids for 10 years, that's a different story.
Revisions are always harder, I'm sure, with all the scarring.
Yeah, they can be. The pocket's stretched and they for sure can be tough. Yeah.
Can you gain weight after a tummy tuck in that
Yeah,
area?
of course. Yeah, absolutely. So, the fat cells are still there. We don't take them all out. That's kind of like what's on the forefront of my practice is I'm starting a wellness center. And the wellness center is centered around this holistic approach to when you come to me, if you still have weight to lose to obtain the best result, I want you to dial in your lifestyle first so that when you have surgery, you can maintain your results. So if people don't change, this is a big, big thing for me. If people don't change this before surgery and then change their habits, you're not going to magically have a tummy tuck and then stay the way you look for the rest of your life. You have to maintain it. It's hard work. So I'm really passionate about people dialing in their health and wellness before surgery, getting their bodies in the perfect place to get the perfect result, and then they have to maintain that afterwards. So that's huge.
I love that holistic approach. So important as physicians to not only worry about the procedure you're doing, but think of the patient as a whole.
Oh, totally. What happened to me, Dr. Ozzy, is I found myself doing slightly higher BMI tummy tucks at one point, and I was like not feeling good about walking out of the operating room. And I looked myself in the mirror and I was like, what are we doing? What is the goal here? It's not my job just to say yes to whoever walks through the door. I want people to look and feel their best. And if that means telling them that they have to get it together before surgery and I might lose them as a surgical candidate, so be it, because I feel so much better that someone does the work, then has the surgery and maintains it for the rest of their life. I mean, that's what it's all about.
Yeah, because these are big, these can be big procedures. So that's a great topic. How would somebody prepare themselves for plastic surgery if they were having a tummy tuck or even a breast augmentation, which is the number one plastic surgery procedure done?
Yeah. So breast augmentation, clearly everyone should be a happy body status. I'm never about skinny versus fat. I'm not a body shamer. But clearly if someone's obese and they've got big breasts, it's going to be hard to augment that patient and have it look good. So for breast augmentation, sure, you want to be at a healthy, happy weight, right? Because as you lose weight, your breasts are going to sag for most people. So you wouldn't want to get an augmentation and lose a bunch of weight. You want to lose a bunch of weight and then come back. And I actually did that with a patient who was at her preoperative visit. And we were going to do an augmentation and a lift. And I walked in the room and I sit down, I start talking to her and I was like, what's wrong? And she was like, I don't know. I'm like, are you nervous about surgery? What's going on? And she was like, well, ever since my last baby, I've got more weight that I've been trying to lose and I just can't get it off. And I was thinking, okay, so how much do you want to lose? Thinking she was going to be 2 or 3 pounds. She was like, I'd like to lose another 10 or 12 pounds. And I was like, all right, pump the brakes. I'm like, let me tell you about this macronutrient coach who's a nurse practitioner in my practice. That's a significant amount of weight that your breast could change. And I don't want to take you to surgery next week, have you lose all this weight and then come back and have sagging breasts with the breast hanging off of the implant. That's going to look horrible. And we literally canceled her surgery. She signed up to work with my macronutrient coach and lost 18 pounds in 3 months. Came back and she came back and had her surgery. And I just saw her for 1 year for a follow-up. She's ripped. I mean, she's
Nice.
jacked. She like
I
took it
love
to the
it.
next level. Like she got
Nice.
super fit and she looks amazing. And she's like, thank you so much for turning me down that day because I'm so much
Awesome.
happier today. So that's really important. I was going to say, so nutrition coaching is huge because I feel like a lot of people are frustrated because they think they've done everything. They don't really know how to count their macros or how to count food, which I think is important in the beginning when you're trying to learn how to get healthy. And so that's why I'm providing it for them. So my message to people watching this would be, if you're the person who looks in the mirror and says, I've done everything I can do, I eat well, I exercise, I've done it all, there's nothing else I can do, you're probably wrong. You need to find a good nutritionist who knows what they're talking about because you're probably calorie restricting, which is completely opposite of what you need to do. So I would find a reputable, really good nutritionist and I would work with them to get your body in shape before surgery so that you can have an amazing result. So that's what I would tell people.
Nice. I'm just loving this holistic approach. It's very refreshing. So tell us about, you said you were thinking of having a wellness center or you're in the works of a wellness center.
Oh, it's being, yeah, no, it's being.
Scottsdale is the perfect place for that.
I know. Totally.
I would come stay there.
I would love that. Well, you're gorgeous. You don't need me. But I would love to have you here. So here's the deal. It was a business idea about 4 years ago. My COO and my staff are sitting next door business planning it right now. We've been working on this for the past couple of years. I've got a double board nurse practitioner, the macronutrient coach I mentioned, who's going to be our nurse practitioner for all the food nutrition. We're going to have a meal planning service. I have a guy who's selling his gym and is going to come on as our fitness expert.
Nice.
I'm going to get a mental body image specialist because I think fixing the mind and how you feel about your body first is important. Mm-hmm. So it's going to start out that way. I have a crew that's going to we're going to say like, hey, you came to me for a tummy tuck. You're not ready. Instead of sending you out to go somewhere else to do all of this because I'll lose you, we have it all under one roof. We're going to put you through this process and we're going to work on you. And if, hey, listen, you come back to me and you don't need a tummy tuck because you lost so much weight and you look amazing, good for you. No surgery for you. But my goal is with COVID, we've seen this, that all of the unhealthy obese patients are the ones that are really, really having problems. Yes, there are a lot of other people who are not obese that are dying, but we've seen that theme in that population. I think that this health and wellness thing is really becoming important to people, and people are kind of getting more woke, if you will, to the fact that they need to be in a better, healthy position to have longevity in life.
I agree. I think COVID has been a wake-up call for all of us and, has made us want to take better care of ourselves, whether it's mental or, skin or health or wellness. And wow, I'm so excited when this is going to become available. You'll have to let me know.
Me too.
I want to hear about your book, The Real Beauty Bible. Tell us about that.
Okay. So I can't believe I don't have a copy in front of me. Here, I'll show it to you. Okay. So this launched this is what it looks like if you guys want to get it. It's on Amazon.
Nice. I love that.
Yeah, it's on Amazon. There's a Kindle version, there is Audible version, and then there's the hardback. They can buy it on Amazon or they can call my office if they want a copy from here signed. So I always wanted to write a book, but I never thought that I would. And I didn't know what it was going to be about. And so several years ago, I was at a meeting and I heard this group get up to talk about how they help people write books. And I thought, wow, this is my opportunity. What am I going to write about? And that was right around the time where the show Botched was pretty up and running and like a big show. And I thought to myself, I'm so sick of people getting botched. I'm sick of people going to these crazy countries where there are great surgeons in every country, but usually it's going for the cheap stuff that are getting botched and even botched by doctors in the United States. So I wanted to create a guide. And ultimately that's what this became, was a guide where you could pick this book up if you've never had surgery, and you could say the part 1 focuses on, finance. How do I finance my surgery? How do I talk to my spouse about surgery? Because I'm really nervous and scared to talk to them about it. Just all the nuts and bolts things that you need to know about surgery. And then the remainder of the book just goes through the different breast and body procedures and then actually walking people through surgery day, what it feels like, getting the IV and the process. So I really wrote the book because I wanted people to be able to just essentially pick it up, read it and go, oh my God, this is how I choose a board certified surgeon. And here are all the things that I need to know about having this procedure.
Wow. So they can find it on Amazon. They can get it on Kindle.
Yes.
That's awesome. I'm going to check it out. I want a signed copy.
I'm going to send you a copy. You have to give me your address at the end of this.
So much energy. I mean, all of my office staff follows you on TikTok and Instagram. And we always talk about, wow, this guy's so much energy. And it's not just, you do a lot, here you are, multiple hats that you're wearing, but you also are very enthusiastic. And every time you get on, you're just full of energy. I love it. Where do you get that from? Have you always been like that?
Yeah, I'm just a happy person. I'm definitely like a cup is like, 3/4 full, not even half full. I've always seen the good in life. And to be honest with you, I get this all the time. You're not the only one, but I love my life. I have built a life for myself. I like helping people, and negativity doesn't do anybody any good. Do I have down days? Yeah, I do. But I'm an energetic, happy person. It's just how I've always been.
And then how do you find time to do all the TikToks? Do you wear a GoPro during your surgery?
Yeah, I do, but I'll have nurses record some stuff too. But to be honest with you, it's getting really hard. Like I need a full-time social media manager, but I'm psycho because I like to control my message. Like I feel like my message is,
it's always better when you actually are the messenger because it's you.
Yeah, I'm not going to lie. It's hard. I've really had to curtail the way that I do stuff. So I try to get all my stuff done before I get home so that I'm out on the phone all the time, and I try to put it down, and it's really hard. And I'm going to be honest, Tony, you and we're good friends. Everyone thinks we have beef on TikTok, but we're good friends. I look at Tony, I'm like, dude, you are everywhere. Like, how do you do it? Like you're commenting on everyone's posts on IG and on TikTok, and you have all these YouTube videos. I mean, he is my goal, he's incredible.
Yeah,
he's amazing.
It's really hard to do, but you love it. So, you make time for it. I agree. So
and your stuff is awesome.
I'm trying, but
you do great. You really do.
Yeah. Thank you. Final questions. Let's do a rapid fire question and answer because people want to get to know you better. So you go to Starbucks, you order.
I don't drink coffee. So for me, it would be an Arnold Palmer.
You don't drink coffee? You're just natural.
Nope. Never have. I'll drink coffee.
Now I'm getting really jealous here. You don't drink coffee. You're happy. So do you
This is my
Starbucks?
Caffeine. I really don't. I'm not a big Starbucks guy.
Okay. Well, what's your go-to vacation spot? Do you have a vacation spot? Do you vacation at all?
Ooh, yeah, I do. Right now I would say it's Hawaii because I love Maui and I love Hawaii, but I'm sure it'll be somewhere else eventually, but I love Hawaii.
Guiltiest pleasure?
Oof, pizza.
I love pizza too. Hidden talent? Any hidden talents?
Not really. I mean, I guess I played a little bit of college baseball.
And cocktail of choice?
Oh man, Maker's Mark. I love bourbon.
On the rocks or neat?
Neat.
Love it. And lastly, how can people find you online? What are your handles? Where should they go to look for you?
Okay, so my two main are Instagram, which is at Dr. Richard J. Brown. So it's not the word doctor, but at Dr. Richard J. Brown. They can find me obviously on TikTok, but there I'm at The Real TikTok Doc. And then I have Twitter. My Twitter and all those accounts are also at Dr. Richard J. Brown, but I'm not super active on there. And Facebook, it's probably IG and TikTok are my biggest ones. And then YouTube is my practice. I would love to grow my YouTube. So if everyone go follow my YouTube.
YouTube. What is that?
Yeah.
What is it called?
It's Brown Plastic Surgery.
Brown Plastic Surgery. Love it. Yep. And then obviously TikTok, The Real TikTok Doc.
Correct.
Yes.
Got it.
So it's been so great meeting up with you. I'm so happy we got connected on TikTok and now, off social media as well. I would love to come visit your wellness center. That's in the works. It looks like you've got a lot of great projects and yeah. I'm going to sign up for your YouTube channel now.
I appreciate it. I got to tell you, what we need to do is, and I've said this several times, when this COVID thing really passes, we got to get all the TikTok docs together because there are some incredible doctors on that platform that I've met.
I would love to do a hype house.
Heck yeah, we should. We totally should.
Plastic surgeons, dermatologists,
Yeah.
Did he get skincare by Hiram in there?
Heck yeah, that guy, he's awesome. But I think it'd be so fun to get everybody together sometime because I'll tell you, the doctors have exploded on there lately. It's crazy.
Yeah, I remember like when COVID hit, and I was like, wow, why there's so many doctors on TikTok, more so than ever. Like when Instagram started, when Instagram started, it was all like, no, it's not
Oh, yeah.
professional. But now, even the people that were saying that are, social media is the way of the future. And we have to have a voice. We can't be overtaken by some of this nonsense that people are out there with channels saying. I mean,
100%.
we're busting nets all the time on TikTok.
Oh, yeah. No, it's crazy. We definitely need that.
People are saying.
Look, social media has been incredible for me. I mean, I generate a ton of revenue in patients from both IG and TikTok. And I'm blown away by how many people have found me on TikTok to come here for surgery. It's incredible. And I really feel like social media can be used in a bad way or a good way. When it's done in a good way to educate and laugh and educate, but to teach people, it's great. I love it.
Well, I have to say, I have not seen you dance on TikTok. I've seen no dance.
Go way back on my page.
Oh, wait.
Go way back. I did in the beginning.
In the beginning? Okay, I have to go check. All right. Nice talking with you, and hope we're going to do some more collabs here soon.
Let's do it. Thank you for having me.